Hello, so we're gonna do the Thermiva procedure now. So the Thermiva uses a wand that's actually very small and it's curved to really mimic the curvature of our vagina, because the vagina is not straight and it actually dives down a bit in most people, and then it kind of goes back up. And so it gives you a natural curvature, or it follows the natural curvature. The other thing is this metal piece is where the energy comes out. So it's a monopolar radio frequency. And so with this, there is a grounding pad that we put on the patient, and so that the energy flows through the tissue that we're treating. So we put this in the vagina for the internal treatment and then also the external treatment to give you the best results. And when we're treating, we get the energy up to a certain degree to get the desired results. And most patients feel just a warmth, really not uncomfortable. On the outside also just feels warm. And because patient is awake, we get to talk to the patient, communicate, and if there's any discomfort, then we adjust the temperature accordingly. But that is the Thermiva treatment, so I'll show you guys what we're doing today. And depending on patient's symptoms, we treat and customize the treatment based on that. So a lot of patients that come to see us have symptoms of urinary leaking, when they cough really loudly, sneeze a lot, or jumping on the trampoline or jumping jacks, or they're running, they realize that they're leaking some urine involuntarily. Or if they have a very full bladder, if they know they're gonna laugh, they need to really voluntarily squeeze on so that you don't leak urine. And so that's when we focus some of the treatment on really to help with that portion, which is the anterior vagina, or the front for you, but for us it's the top part. If it's a lot of laxity, so after pregnancy, after childbirth, we have a lot more looseness in the vagina. We may be choosing to treat in certain areas that we feel like it needs to be enhanced. But we do treat the vagina in a 360 degrees, because the way it's designed, it's so small, it can go in different crevices, different areas. So it's a very customizable treatment. So, do you feel anything?
Not yet.
Not yet. And usually most people feel a foreign body sensation at first, and then it just initially feels like something's different, but then it's not uncomfortable or painful. In fact, a lot of people say it feels like a hot stone massage, and kind of comfortable, and they fall asleep. And so the treatment usually takes about 30 minutes, half an hour or so. We space out the treatment, kind of really can go from 3 weeks to 6 weeks apart. And we actually treat women right after delivery, as soon as their incision heals, if they have an incision. Some people don't, and you can really treat quite quickly. And we get that tissue that is being remodeled to really recover well. And I find that a lot of my patients that have had recent deliveries, that their healing is actually better. Their healing is more promoted, because we are also recruiting the repair process to really be maximized in the area of treatment. And also the vasculature is promoted as well, meaning we see neovascularization or new blood vessel formation with this type of treatment. And so if you think about it, if you have a wound that is trying to heal, and if you are stimulating the blood flow, it will actually heal better. And so as long as there's no signs of infection, you can actually treat quite quickly or quite early. When you're younger, your tissue is much more pliable, it's more elastic. It has a better repair mechanism spontaneously, and also your hormone when you're younger, it's much more strong. I would say it's a better balance. And so when you hit a certain age, all of that changes. And so when you're fighting all that, you can do it gradually by making sure that your tissue is being stimulated at all times. Our theory is combining treatments that work in different levels and layers to get a more synergistic result. A lot of the times we want to treat the vaginal tissue, the labia tissue, but we want to make sure we focus on the pelvic floor. We also want to make sure we're focused on the pelvic muscle and the fascia and the bony structures. And that's where we treat our patients holistically. We want to make sure their pelvis is aligned, and that once that's done and it's realigned, then your pelvic floor can be more, it can be exercised through the Emsella machine with better results. You have better outcome. And also your internal organs can be more in place, more in the right place. And so when you're doing everything else, it really enhances your treatment results. If you do everything separately, they're all great treatment, but when you combine it, the results are just phenomenal. And women, sometimes we have patients that they initially thought they may need surgery, but then when they get our combined treatment, they don't need to have surgery, and they're really happy, because then they don't have to go under anesthesia and have recovery time, and they not only have their problems solved, but they feel better. They have increased sensation, better sex life, and just they feel better. And so that's why I think it's good to come to see us if you have any problem, to get a full assessment to see where your problem lies and see what we can do to really optimize the person in entirety. So now we are treating, we're done with the vaginal treatment. Now we're treating the outer labia. So this can help tighten the skin and our tissue. And also we're gonna treat in the area of the clitoris. And so this really stimulates that collagen and more vascular. So you can't really see the vaginal tissue change on photos. You can feel it, but you can actually see the tissue change with the labia tissue when you treat with the radiofrequency treatment. So our before and after photos, when patients see how much there's tightening, it's the same concept inside, just that we can't show you, but we see pretty good results. So some people, they have sagging of their labia tissue because of volume loss from fat, and also from stretching from birthing process. And some people too, they have asymmetry in their labia tissue, and so we can also kind of customize it based on that. Let's say one is larger than the other, we can try and focus on that side to make it a bit smaller and to balance it out. Who is a good candidate for this treatment and who's not a good candidate? Really, if you have any symptoms of urinary leaking, if you have symptoms of vaginal laxity, and what is a symptom of vaginal laxity? It's usually when you have a decrease in sensation during intercourse. You just don't feel that much sensation, or you just don't feel that kind of friction as much. And the other thing is, sometimes with certain positioning or even during sex, you have kind of air coming out of the vagina, and that's from trapping of the air into a funneling shape of the internal vagina. And so once that position changes, or when during sex, that air releases, and so you can hear that, you can feel that air coming out. That's definitely a sign of vaginal looseness or laxity. But the number one sign, I think, for women is they're not feeling so much during sex, and so their intimacy dramatically decreases, which doesn't have to be the case, and which can be quite improved with this treatment. Sensation, laxity, and urinary symptoms are the main symptoms that we get. But we also have women that they had babies, and they want to make sure that their well stimulated, their tissue is well stimulated. So we see a lot of women that we are doing preventative and making sure her tissue is always healthy and well vascularized.